Young surgeons questioned the retired doctor's advice. Until he saved the patient. They gave up on the hospital's surgical wing, smelled like antiseptic and ambition. Young voices echoed down corridors lined with awards and photographs. Achievements measured in publications, procedures, innovations. This was where medicine met empire, where careers were built on precision and speed. Dr. Marcus Webb didn't belong to that world anymore. He stood in the observation gallery above operating room 3, his hands resting on the cold metal railing. 72 years old, mostly retired, coming in twice a week to consult. That's what they called it. What they meant was stand aside and watch the future work. Below him, Dr. Sarah Chen led a team through a routine thoracotomy. 29 years old, Stanford trained, published in The Lancet. Her movements were crisp, efficient, textbook perfect. Around her, 4 other surgeons, none over 35, moved like a Formula One pit crew, fast, confident, brilliant. Marcus had trained in a different era, in field hospitals where the textbook was what you learned to do when the textbook failed. Dr. Webb, a voice behind him. Dr. James Park, the department head, 38, already being mentioned for positions at Johns Hopkins. Didn't expect to see you today. Tuesday consultation, Marcus said quietly. Still on the schedule. Right. Park's smile was professional, distant. Though with the new imaging protocols and the robotic assistance program, we're finding less need for traditional approaches. Traditional, the word hung in the air like smoke. Marcus nodded. He understood. He was becoming a museum piece, a reminder of medicine before machines could see inside bodies without cutting them open, before algorithms could predict outcomes with 97% accuracy. I appreciate the legacy you've built here, Park continued, the foundation you laid, but surgery's evolved. The residents, they're learning techniques we couldn't have imagined 20 years ago. 20 years ago, Marcus had been extracting shrapnel from a Marine spine in a tent hospital outside Fallujah, while mortars fell 200 yards away. But he didn't say that. People here knew his CV. Chief of surgery for 15 years, decorated military service, hundreds of successful procedures. What they didn't know was what those decorations meant, what it felt like when your hands were the only thing between a 19-year-old and death, and the nearest CT scanner was 6,000 miles away. Of course, Marcus said. Below, Dr. Chen was closing, efficient, clean. The patient's vitals were stable on the monitors, heartbeat steady, oxygen saturation perfect, everything by the numbers. Why don't you head home early today? Park suggested. I'll mark you down for the full consult hours. It wasn't a suggestion. Marcus gathered his coat. As he turned to leave, something made him glance back at the monitors. Just habit, old instinct. The numbers looked fine, perfect even. But something whispered at the edge of his awareness, something he couldn't name yet. He left the gallery as the intercom crackled overhead. Trauma incoming, multi-vehicle accident on the interstate, ETA 4 minutes, all available surgical teams to ER. The hospital shifted like a battleship changing course. Residents ran, elevators filled. Somewhere, someone was fighting for their life, and the machine was preparing to save them. Marcus stood in the hallway for a moment. Then he walked toward the ER instead of the exit. Old habits. The emergency department was controlled chaos. 3 gurneys burst through the automatic doors simultaneously. Paramedics rattled off vitals while nurses swarmed. The air filled with the language of crisis. Blood pressure dropping, GCS of 8, massive internal bleeding. O negative, type, and cross. Get him to OR now. Marcus stayed back near the nurse's station, watching, not interfering. The first patient was already being wheeled to surgery, compound fracture, stable enough to wait for orthopedics. The second was a teenager, conscious, crying, asking about her mother. Minor injuries. They moved her to imaging. The third gurney stopped in the center of the trauma bay. Male, mid-40s, unconscious, chest crushed from the steering wheel. The paramedic's voice was tight, hypotensive, tachy at 130, decreased breath sounds on the left, probable hemothorax. Lost his pulse once in the rig, got him back. Dr. Chen appeared, still in her scrubs from the previous surgery. She moved fast, calling orders. Chest tube, pressers. O negative. Her team assembled around the table like they'd been training for this their whole lives, which they had. Marcus could see it from 30 feet away, the way Chen's jaw set when she saw the initial chest x-ray on the portable unit, the way her eyes tracked to the monitor, then back to the patient's chest wall, reading the story written in broken ribs and accumulating blood. "Massive hemothorax," she announced. "He needs surgery now, or 2. Tell them we're coming up." They moved. Marcus followed at a distance, taking the stairs while they took the elevator. By the time he reached the observation gallery above or 2, they were already prepping the patient. Chen's hands moved with remarkable speed, establishing access, draining the chest cavity, preparing for the thoracotomy. "Pressure's dropping," one resident called out. 80/40. "More blood," Chen ordered, "and push the epi." The anesthesiologist adjusted his dials. Numbers flickered on screens. The patient's body lay open now, Chen's hands inside the chest cavity, searching for the source of the bleeding. Marcus watched her face, saw the moment she found it. Her expression didn't change, but her hands paused, just for a second. Then she was moving again, faster now, trying to clamp the vessel, but the anatomy was wrong somehow. The bleeding wasn't stopping, and "Pressure's 60/30, the anesthesiologist said. "Quieter now. The way you speak when you're watching someone die." Chen's voice stayed level. "Another unit, and get me better suction." But Marcus could see it, the blood pooling faster than they could evacuate it, the vessel torn in a place that shouldn't have been possible with that impact pattern. Something else was happening, something they weren't seeing. He stood, moved toward the intercom that connected the gallery to the OR. "Dr. Chen," he said quietly into the microphone. She didn't look up. "Not now, Dr. Webb. The bleeding's not from the intercostal vessels. I can see what I'm operating on." Her voice was tight, professional, but strain was bleeding through. "We're managing it. The trajectory of impact suggests posterior mediastinal involvement. Check the descending aorta." "We've already assessed. Pressure's 50/25, someone interrupted. Chen's hands kept moving. "We need vascular up here now. Page Dr. Morrison." "He's in another surgery," a nurse called back. 30 minutes minimum. This patient doesn't have 30 minutes. Marcus was already moving, out of the gallery, down the stairs, through the scrub room. He could feel eyes on him as he began washing his hands. A nurse appeared in the doorway. "Dr. Webb, you're not scheduled for—" "Get me gloves," he said quietly. "Size 8. In the OR, Chen looked up as he entered. Her eyes widened above her mask. "Dr. Webb, what are you—" "Step aside, Dr. Chen. This is my patient, and he's dying." Marcus's voice was calm, steady, the voice he'd used in field hospitals when there was no time for rank or protocol. "You're looking in the wrong place." For a moment, the room held its breath. Chen's jaw worked behind her mask. Pride warred with reality. The monitors beeped their urgent rhythm. 50/23. 50/20. She stepped back. Marcus moved to the table. His hands found their way into the chest cavity like they were remembering an old language. 72 years old, and his fingers still knew how to read the topography of the human body in the dark. There. What Chen had missed because she'd been trained to look where the textbooks said to look. The aorta was intact, but there was a branch vessel, small, easy to miss, torn along the posterior mediastinal wall, hidden behind lung tissue that had shifted from the impact. "Retract here," he told the resident across from him. "Gently." The young surgeon obeyed. Marcus could feel them all watching now, the whole room holding its breath. His hands moved with the muscle memory of 40 years and 100 impossible saves. Not fast like Chen, not textbook perfect, but certain. He clamped the vessel, tied it off. His sutures were slower than Chen's would have been, but each one was placed with the precision of someone who'd learned surgery when every stitch mattered because there might not be blood for a transfusion, might not be backup, might not be tomorrow. "Pressure's rising," the anesthesiologist said, surprise in his voice. 60/30, 65/35. The bleeding slowed, stopped. Marcus worked in silence, repairing what needed repairing, checking what needed checking. The room had gone completely quiet except for the monitors and the soft hiss of the ventilator. Even Chen stood motionless, watching. 15 minutes later, Marcus stepped back. "Close him up," he said quietly. The resident moved forward automatically, then froze, looking at Chen for permission. She nodded slowly, her eyes never leaving Marcus. "Pressure's stabilizing," the anesthesiologist reported. 80 over 50, 90 over 60. He's coming back. Marcus stripped off his gloves, dropped them in the bin. His hands were steady, but he could feel the tremor starting in his forearms. Age, adrenaline, the cost of remembering how. He walked out of the OR without a word. Marcus sat in the surgeon's lounge, a cup of cold coffee in his hands. The room was empty. It usually was at this hour, everyone either in surgery or on rounds. He preferred it this way. The silence, the space to let his hands stop shaking. They always shook afterward these days. Had been for the past 5 years, not during, never during, but after. When the adrenaline drained away and left behind just an old man in scrubs who'd remembered, for a moment, what it felt like to be necessary. The door opened. Dr. Chen stood there, still in her surgical cap, mask pulled down around her neck. "He's stable," she said. "ICU's monitoring him, but vitals are good. They think he'll make it." Marcus nodded. Chen crossed the room slowly, sat down across from him. For a long moment, neither spoke. "I missed it," she said finally. "You were looking where you were taught to look." "You weren't. I was taught differently." Chen's hands clasped together on the table. Her knuckles were white. "I've performed 143 thoracotomies, published 2 papers on minimally invasive approaches. I thought I knew—" She stopped, started again. "Where did you train?" "Here," Marcus said. "Hopkins for residency, then 22 years in the Navy." Navy. Something clicked behind her eyes. The field hospital program. Marcus took a sip of cold coffee, grimaced. "Among other things. How many combat surgeries?" "Stopped counting after the first tour." Chen was quiet. Then, "Afghanistan?" "Iraq first, then Afghanistan, then back to Iraq." His voice was flat, reciting geography like it was just places on a map instead of coordinates where he'd learned to operate while the ground shook. After that, training rotations in Germany, consulting in Syria through NATO medical initiatives. "What was it like?" Marcus looked at her, really looked, saw past the brilliance and the ambition to something younger underneath. Someone who'd chosen this profession because she wanted to save lives before the system taught her to. Measure success in publications and procedure times. "It was medicine without the safety net," he said quietly. "No imaging backup, no specialists down the hall, sometimes no electricity. You learn to read the body with your hands because that's all you had. And you learn that the textbook works 95% of the time, but the other 5% is where people die." "Is that why you caught what I missed?" "That's why I looked for it." Marcus set down his coffee. "You were running the playbook perfectly, trauma protocol, step by step. But playbooks assume normal anatomy, predictable injury patterns. In the field, nothing was predictable. You learned to check everything, trust nothing, and follow your instincts even when the monitors said you were wrong." Chen absorbed this. "Dr. Park said," she stopped herself, "that my methods were outdated." A flush rose in her cheeks. "He didn't say it like that." "He didn't have to." Marcus stood, joints protesting. "He's not wrong. Medicine has advanced. Your generation has tools we never dreamed of. Imaging that can see things we had to guess at. Robotics that can operate with inhuman precision. You're going to save more lives than I ever could." "But—" Marcus moved to the window. Outside, the city spread out in the late afternoon light. Somewhere in this building, a man was breathing because Marcus had remembered how to see what others didn't. "But medicine isn't just tools," he said. "It's also instinct, pattern recognition. The 1,000 small things you learn when you don't have the tools, when it's just you and the patient, and the choice between trying something the textbook doesn't mention or watching them die." He turned back to her. "You're brilliant, Dr. Chen, legitimately brilliant. But you were trained in an era of abundance, abundant technology, abundant backup, abundant time to consult and analyze. I was trained in scarcity. And scarcity teaches you things abundance can't." Chen stood, crossed to the window beside him. "Teach me." "What?" "Teach me what scarcity taught you." Marcus studied her face, saw something there he recognized. the same thing that had driven him into medicine 40 years ago. Not ambition, not prestige, the simple, stubborn need to be the person who didn't give up. Your generation doesn't want to learn from mine, he said. My generation, Chen said carefully, is very good at reading studies and following protocols. We're less good at understanding that the best knowledge doesn't always come from journals. She paused. That patient lived because you knew something I didn't, something that's not in any textbook I've read. I want to know what else I'm missing. The door opened again. Dr. Park entered, his expression unreadable. Dr. Webb, Dr. Chen. He nodded to each of them. I heard what happened in OR 2. Marcus said nothing. Impressive save, Park continued. Truly, though I have to say, walking into a surgery without being called, without formal consultation, it's highly irregular. The patient was dying, Marcus said simply. We had it under control. With respect, Dr. Park, you didn't. Chen's voice was quiet but firm. Dr. Webb identified a vascular injury I missed. Without his intervention, we would have lost that patient. Park's jaw tightened. Dr. Chen, I appreciate the learning moment, but proper protocol, save no one, she interrupted. Dr. Webb did. The room fell silent. Park looked between them. Marcus could see the calculation happening behind his eyes. Pride versus outcomes. Protocol versus results. The new way versus the old. Finally, Park spoke. Dr. Webb, your contract specifies consultation only, not active surgery. I understand. However, Park paused. Given today's results, I think we should discuss expanding your role. Perhaps a more active teaching position, sharing some of your field experience with our residents. It was as close to an apology as Park's pride would allow. Marcus felt something shift in his chest, not triumph, not vindication, just a quiet recognition that maybe he wasn't quite obsolete yet, that maybe the things he knew, the hard-earned, blood-bought lessons from field hospitals and combat zones, still mattered. I'd be honored, he said. 3 months later, Marcus stood in front of 12 surgical residents in the simulation lab. Pop quiz, he said. You're in a rural hospital. No CT, no vascular surgeon, no backup. Patient comes in with a penetrating chest wound, pressures dropping. What do? Hands went up. He pointed to a young resident in the back. Stabilize, evacuate to a trauma center. Nearest trauma center is 2 hours away. Patient has maybe 20 minutes. Next, another resident. Emergency thoracotomy. Identify and clamp the bleeder. Good. What if you can't find the bleeder on initial exploration? Silence. Marcus walked to the simulation dummy on the table. This is where the textbook ends and medicine begins. This is where you learn to trust your hands. Dr. Chen stood in the back of the room, observing. She'd requested this rotation be added to the residency program. Practical emergency protocols, they called it. What it really was, lessons from the edge, taught by someone who'd lived there. The residents leaned forward as Marcus demonstrated techniques that didn't appear in any modern surgical text. Methods he'd learned in tents and bunkers and the backs of moving vehicles. Ways to see with your fingers what machines couldn't show you. How to make decisions when there was no time for committee consensus. This was his new role, not the lead surgeon, not the department head, the keeper of old knowledge, the translator between eras. After the session, Chen approached him. Dr. Morrison wants to observe next week's class, she said. He's the one who always said your methods were dated. Now he's asking to learn them. Marcus smiled. Times change. They do. Chen hesitated. The patient from 3 months ago, the accident victim. He came by yesterday, wanted to meet the surgeon who saved his life. You operated on him. We both did, but I told him the truth, that you saw what I couldn't. And what did he say? Chen's expression softened. He asked if you were the old guy everyone was trying to retire. I said yes. He said, good thing you're stubborn. They walked together down the hallway, lined with photographs of past department heads, past achievements, past generations of surgeons who'd built this institution, stone by stone. Marcus stopped in front of his own photograph, taken 20 years ago when he'd been named chief of surgery. Younger, less gray, the same eyes. You know what I learned in all those field hospitals? He said quietly. Chen waited. That medicine isn't about being the smartest person in the room. It's about being the one who doesn't give up, the one who keeps looking when everyone else has stopped, the one who trusts that somewhere, somehow, there's an answer, even if it's not in the textbook. He turned to her. You found that in yourself 3 months ago. When you asked me to teach you instead of defending your pride, that's rarer than brilliance. That's wisdom. Chen's eyes glistened. I almost killed that man. No, you almost failed to save him. There's a difference. Marcus's voice was gentle. Every surgeon has those moments. The question is what you do afterward. Do you hide behind protocol and pride, or do you ask what you missed and learn to see it next time? Is that what you did after your first... She stopped. My first loss? Marcus finished. Marine, 19 years old, IED blast. I did everything by the book, everything I'd been trained to do. He died anyway. The memory was old, but never distant. I carried that for months. Then my commanding officer told me something I've never forgotten. He said, Webb, you can't save everyone, but you can save the next one. So learn from this and be better tomorrow. Did you? I learned. Whether I got better, you'd have to ask the patients. Chen smiled. The ones who lived would say yes. They resumed walking. Behind them, the photographs watched in silence. Generations of healers, each building on what came before, each learning that medicine was equal parts science and humanity. That evening, Marcus sat in his study at home, surrounded by 40 years of accumulated memories. Medical journals stacked on shelves, commendations in frames, a bronze star he'd never displayed, photographs of teams in desert camo, outside field hospitals, young faces exhausted and determined. His hands rested on his desk, steady now. They'd saved another life today. One of Chen's cases, a complicated repair that she'd handled brilliantly, but had called him in to consult on. Not because she needed him, because she wanted to make sure she wasn't missing anything. That was the legacy he was building now. Not in his own surgeries, but in the ones he taught others to perform. Not in his own brilliance, but in the wisdom he could pass on before it was too late. Outside, the sun set over the city. Somewhere, a hospital was running through the night. Surgeons were making decisions. Patients were fighting. The ancient dance of medicine and mortality continued, as it always had, as it always would. Marcus thought about that Marine, 19 years old, dying in the sand despite everything Marcus knew, everything he'd tried. He thought about the man from 3 months ago, alive because Marcus had been too stubborn to retire when they'd wanted him to. You can't save everyone, but you can save the next one. He opened his laptop and began drafting next week's lesson plan, advanced field techniques for resource-limited environments, the things he'd learned when medicine stripped down to its essence, 2 hands, 1 life, and the choice to keep trying. The photographs on his wall watched him work. Younger versions of himself, older patients who'd survived, team members who'd stood beside him in the worst places, doing the hardest work, asking nothing except that it mattered. It had mattered. It still did. Dr. Marcus Webb still consults at the hospital twice a week, but now, 3 times a week, he teaches. The residents call his class field surgery, though the official name is different. They pack the simulation lab to learn the things that don't appear in journals, how to think when the machines fail, how to trust instinct when the data isn't there, how to keep trying when the textbook says it's over. Dr. Chen runs the department's trauma program now. On her desk is a photograph, an old surgeon and a young one, standing side by side in an OR, hands scrubbed and ready. The patient from the accident visits every year on the anniversary, brings his grandchildren, tells them about the doctor who was too stubborn to retire and too skilled to be ignored. Medicine changes, technology advances, protocols evolve, but some things remain constant. The value of experience earned in hard places, the wisdom that comes from seeing what others miss, the quiet courage of showing up even when you're dismissed, even when you're doubted, even when the world says your time has passed. Because courage isn't measured in degrees or publications. It's measured in the lives you save when everyone else has stopped looking, and in the knowledge you pass on before the silence takes you too. History forgets the noise. It remembers the hands that kept working in the quiet.